First of all, I want to welcome Dr. Ashish Batil, um, a urologist, but also an innovator in the field of the simulation from India. So let me start, Dr. Ashish, by asking about the simulation training in the urology. What can you say about it?
I think simulation training, Dr. Hamadi, is an upcoming subspecialty of urology, and it has all come out because of the um, problems with the doctor training on the patient. So it's a right of every patient to have a trained doctor to operate on him, and it's the right of every student to have good knowledge before he operates upon a patient. So that's how I think this subspecialty of simulation is emerging.
So, is there a key component for this training to be successful?
I think the simulation training basically composes of small tasks which the doctor needs to learn, which involves manual dexterity, mental ability, and cognitive skills. In order to be able to treat a patient successfully and give him a desirable endpoint.
So, this simulation technology, is it evolving, or it's like a stationary technique?
So, like all the fields of urology, simulation also is a technology that is continuously evolving, and every simulator that comes out is an improvised version of the previous one. So, as the other technology fields, this too is an evolving field, and especially more so because it's a new field.
So we can say that it is definitely has advantages over the traditional training.
Yes, if you see over the past 10 years, simulation has grown exponentially, and that is because it has shown definite advantages in urology training, and that is what the students are wanting now. Yes.
So, are there specific procedures or techniques in endourology where simulation technique and the training has shown particularly promising results?
I think the endourology subspecialty has shown very promising results, wherein the students can now first train on doing surgeries like PCNL, RIRS, and TURP, along with cystoscopies, bladder stone surgeries. And that has definitely, those simulators have evolved much more. The simulation in the field of andrology is yet evolving, and I think in general we are having good simulators now on which the students can efficiently be trained.
So there is challenges. Anything or any new technique or any new technology has the challenges and the limits. So what's the challenges and the limit of simulation?
So simulation at the moment does have some drawbacks in the sense 3D simulation is still evolving. There is a problem with haptics in simulation because no artificial tissue has been able to give the exact haptics of human tissue as of date. But I think over the next 10 years, we will be seeing a lot of evolution and research in this field.
Um, so how important to incorporate this simulation training to the curriculum of the residents, the urology residents?
So, Dr. Hamari, I give you a simple example. In order to gain knowledge, any student has to read books. Reading books does not teach any student or any doctor practical experience. So, for the practical experience, he has to go to the wards and see patients. For surgical experience, he has to operate on someone to gain the surgical expertise. And I think this surgical expertise can be got only by operating on dummies first till he has practiced enough to go on to a live patient.
So I think for this reason, the technology should be validated. So is there any kind of validation or accreditation of a specific simulators for each endoscopic procedure?
So the validation in simulation is a big problem. The face validity, for example, content validity can be done. But how does a student perform after doing a simulation training and then going on to a patient? Or does he perform in a different way if he goes directly on the patient is something very, very difficult to study. And none of the simulators till date have been exactly been evaluated in that way. But the face content construction validity definitely have been done for all the simulators.
So I think we will wait for the future to come up with certain number or certain hours of training on simulators, and then the resident would be validated to perform on patients.
Yeah, so there are quite a few medical schools and medical universities who have already prescribed certain hours of simulation training. It's a sort of blanket kind of prescription for the student that he has to train for that many hours on the simulator before going into the OR with assisted learning of surgeries.
Thank you, Dr. Ashish. It was a very informative interview, and I wish to see you again.
Thank you, Dr. Hamadi.
Thank
It
you
was
very
indeed a
much.
pleasure to be on this side of the microphone.
Thank you very much. Thank you.